Thank you very much, John, and thank you very much, Professor Grouvet. Just to say that we do hope that this first symposium will be just the beginning of a strong collaboration between the association, between British Surgery and the UEMS, and to take this opportunity to thank Professor Grouvet and my predecessor, Professor Papalois, for their amazing collaboration and mentorship over the last few years. My name is Vassilios Papalois. I'm a consultant transplant surgeon at the Hammersmith Hospital and the head of renal medicine and transplantation at Imperial College. And as Professor Grouvet most kindly said, I was recently elected president of the UEMS-Section of Surgery. Jacques gave you a very comprehensive presentation about the identity of the UEMS, and I don't want to go into this again. There is no point. Nobody can surpass Jacques in presenting the UEMS vividly. But one slide, just to say, when people ask me in our country, in the United Kingdom, what is the UEMS, the answer, I think, in one sentence should be in people's mind, is basically the BMA of the European Union. And it's not only of the European Union, it's beyond that in many other European countries. Jacques presented to you that it's 54 years young, representing 35 countries, a lot of sections with a very healthy budget and a very active presentation at the heart of the European Union with direct contact with the commissioners and with the MEPs promoting the interests. So this is the picture which you have it. What now we're going to do is to dissect into one of those sections, which is the section of surgery and its current achievements, its current work, and its current aspirations. The UEMS section of surgery consists basically from delegates from the national surgical associations. So the section doesn't exist, or if you wish, the section exists because the national association exists. And the associations contribute to the work of the section by contributing 1 or 2 delegates with voting rights, offering financial support by paying their fees, organizational support when you organize our meetings in various European countries, and of course, by offering faculty that provides manpower to the various quality control projects that the sections and its divisions are organizing during the course of every academic year. The offices of the section are in Berlin. There is a very active website that you can see over there, and the section has under its umbrella 11 surgical specialties which more or less match the surgical specialties under the auspices of the Association of Surgeons of Great Britain and Ireland. Every surgical specialty is supported by a division responsible for the operational aspect of things and by educational board responsible for the educational aspects and the examinations. What is the current work of the UEMS section of surgery, especially in collaboration, the one which is developing in collaboration with the national associations? First of all, we have joint sessions in every meeting that we have with the association hosting the event. And the main aim of this joint session is for the association to present their challenges, their anxieties, their aspirations about the future of the surgical profession in their own country, and for the section of surgery to present the European perspective for the same issues, and then try to define common ground, common action points for the future. Very recently, as an example, we had similar meetings in Spain and in Malta with the Spanish and the Maltese surgical associations, and the result of those was absolutely fantastic. We have helped the Spanish association to establish high, top quality control mechanisms for the monitoring of the progress of their training in their own country because they don't have such a thing as an exit exam. And in Malta, we work in 2 areas. Number one, ensuring high quality of training in the Maltese NHS, and also helping our Maltese colleagues to collaborate with other European colleagues in applying for big European research grants. The next thing regarding the collaboration of the section with the national associations is the issue of the agenda, the topics for discussion, the debate from the future, coming not from the top down, but from the bottom up. So the associations are the ones feeding the section with topics. And I will mention 2 very characteristic examples that came from the collaboration with the Association of Surgeons of Great Britain and Ireland over the last few months. The topic that Professor McPhee put on the table is the issue of the future of emergency general surgery in Europe, which is a very, very hot potato. And the moment this was presented in Malta, all countries were up and saying, yes, we are facing a crisis at the moment about this. We need to do something about it collectively. I'm sure most of you have seen a fantastic document that was produced by the association with a very thorough analysis of this issue, saying, for example, that our Scandinavian colleagues have certain plans for the future and are dealing a little bit better than us with this. I can tell you it was not the case in Malta. They are facing a crisis and they are trying to deal with that. Various models were suggested, so we have a working group in place that will liaise with all the national societies and will come up with a proposal for consultation and discussion before we go back to the UEMS and then to Brussels to lobby hard for the future of it. Also, another hot potato that is being discussed thoroughly in this association is the issue of the future of our profession. We know what we are doing at the moment. The challenges are enormous. We need to define ourselves before somebody else does it for us, where we want our profession to be in the future. And this is not only a UK debate, this is a pan-European debate. Also, we work very hard to have an engagement of the memberships of the members of the associations beyond the delegates. If we leave the link between the section of surgery of the UEMS and the associations to the 1 or 2 delegates, we have lost the game. The delegates have to be just the bridge to allow many colleagues to go above it and go on board and be engaged heavily in the various activities of the section. We have a very active website, and our aspiration is to create a pan-European forum through the website for debate of issues related to the surgical profession in Europe. And also, we have a very active program for developing accreditation of the various surgical skills laboratories that do exist around Europe, but most of them operate with basically no proper governance regulation, and they can't be part of formal training schemes. What is the modus operandi of the section of surgery? It's very democratic. Everything is being done and decided by vote. It's very transparent. Everything regarding the minutes, the accounts are open to scrutiny from all the associations contributing to the section. And also, we work over the concept of consensus. I always say that the European project is a total catastrophe when somebody is trying from the top down to impose an idea. So somebody comes and tells you what you have achieved so far in your country over the years is nothing. You have to rip it off, wipe it off, and replace it with this. A European project is a true triumph when we see around us, we learn from the fantastic traditions and achievements of various European countries. We use this in order to fill a vacuum where there is a vacuum, to complement a weakness wherever there is a weakness, and if there is excellence, to learn from this and help others to learn from this. And this is the way we operate in the section of surgery, and this is the overall philosophy of the organization. I was asked at the council meeting on Tuesday, how do you do it? How do you manage around the table all European nations to agree as to what is the consensus? How do you reach consensus? And I have to say, we don't do it in a way that satisfies everybody from the point of view that the bar is very low so that everybody can go above it. We do it in a way that the bar is high enough so that if somebody goes above it, he can be accepted as, a professional, a specialist at the European level in any European country. But we have to be extremely careful when we put the bar high, as we have to do, and we always do, to make sure that we don't thrash or trash anybody who can't go above the bar at this specific stage. It is our duty to lead, but it is our duty also to help weaker nations to be able to develop eventually and be able to meet those high standards. Otherwise, we will face this horrible situation where we look forward and upwards and we go forward and we miss what is happening behind us. The section of surgery is divided in divisions and boards, as I told you, every one of them serving a different surgical specialty. And the delegates for every division and board come from the national societies, and they work very close with the relevant European society, scientific society. And our quality control projects aim always to harmonize, but harmonize not from the point of view of straitjacketing, of trying to make everything look exactly the same, but by deciding collectively and reaching consensus as to how high should be the bar and ensuring that everybody meets those high standards. And I will go totally unselfishly to describe to you the work and the projects of the Division of Transplantation, which I chaired over the last 4 years, just to give you an example of all the projects going on within the various divisions of the Section of Surgery of the UEMS. What happens in the Division of Transplantation, more or less, happens in the other divisions as well, but you can use this as a simple model. So when it comes to the application, eligibility, and fees for the examination for the European Diploma in Transplantation Surgery, the principles are as follows. We had divided the examinations in 4 modules: retrieval, kidney transplantation, pancreas, and liver. And this is in order to be able to reflect what happens in real life, because in transplantation, not everybody practices all these things together. They practice usually some elements of it. All applicants have to take Module 1. We believe that everybody should be able to retrieve properly organs, and from there on, he or she can apply for any one of the other modules. We want to see in the logbooks actual surgical experience. No one who has been an assistant for life can have even a sniff of a chance to be eligible for this kind of examination. And the number of operations we demand per different type of operation is very high. To give you just one simple example, for liver transplantation, we ask for applicants to have at least 25 liver transplants under their belt as surgeons with or without supervision. So this is a pretty significant number. Also, we ask them to demonstrate that they are competent in the complete management of the transplant patient. Nobody can say, I know how to cut and stitch, but I don't know how to do before surgery or after surgery. Also, we demand a very strong and very complete academic portfolio, not only from the point of view of having an MC, an MD, or a PhD, but by demonstrating continuous presence in the arena of research and academic work, which is of substance and formally recognized. All these documents and all this experience is being assessed per applicant by 4 independent reviewers, and then the fees are totally 400 euros, 200 euros for eligibility and 200 euros for the examination. And this might look a little bit on the low side, but I have to tell you that number one, we have designed it in a way that this is not a money-making process. This is not a money-making machine. Secondly, the amount of 400 euros, the whole lot, close to 350 pounds, might be not so high for somebody working in the UK or Germany, but it can be very high for somebody who works in East or South Europe. And we always try to take into consideration everybody involved. And also, we try to keep the running costs of the examination to a bare minimum. There are no social events, no jollies, it's very neat and to the point. The exam per se. Prior to the examination, we send to the applicants masses of material regarding suggestive reading that they can use to prepare for the examination. The examination is being done per module: retrieval, kidney, pancreas, and liver. We have 2 panels that examine every applicant for every single module, and every panel has a minimum of 3 examiners. One of them is external and is appointed by the European Society of Organ Transplantation. And the type of questions are either from the syllabus, which is published on our website, complicated clinical scenarios, which are coming with a lot of audiovisual material, and also a discussion of papers, scientific papers that we have given to the applicants far ahead of time. In transplantation, the examination is an oral exam only. Other divisions have an MCQ attached to it. We don't believe specifically that an MCQ can add something more compared to what many experienced examiners can examine for hours and hours around the table. But other divisions do believe and they do have an MCQ. The time is 60 minutes per module. So you can imagine if an applicant wants to pass all 4 modules, he has to be examined for a total of 8 hours by a big number of examiners, all of them at the top of their profession, coming from all over Europe. The failure rate is around 30%, and it's only a pass-failure rate. There is no ranking. They have the right to reapply only once. And if they fail for a second time, then we demand that they will have at least another 2 years of training in transplantation surgery before they are able to apply again for the examination. They have the legal right to appeal, and if they are successful, they are awarded the European Diploma in Transplantation Surgery. What is the quality control of the exam? Every examination session for every applicant, for every module, for every panel is minuted. So one of the members of the panel is keeping notes, not detail what was said word by word, but the basic points that made the panel to pass or fail the applicant. There is a discussion by all the members of the division at the end of the examination for borderline situations, and we need 70% plus of the votes for somebody to pass. There is a report that we need to submit for the overall examination to the UEMS and the European Society of Organ Transplantation. The external examiners provide their own independent report to ESOT. And finally, every 3 years, we have established now an inspection, an external inspection by SESMA, the Council of the European Specialist Medical Assessments, which is the UEMS organization which is designated to do exactly this. We also offer the opportunity for honorary diplomas. When we established the whole process in transplantation and in many other specialties, we had the dilemma what to do and how to engage colleagues who were too senior to be sitting around an examination table. The option, there were 3 options: either to ignore them, which is totally inappropriate; secondly, to try to force them to take an examination at the age of 55 or 60, it will not happen; or give them the opportunity to apply for an honorary diploma. So they have the chance to do it, providing that they have 10 years minimum as specialized surgeons in transplantation in Europe. They have to be recognized leaders nationally and at the European level. They have to be highly commended by 4 of their peers. They have to complete an application and pay the 200 euros of fees, and the decision is being made by a subcommittee appointed by the whole division. And the failure rate is approximately 15%. And you can see here that since we started the examination in transplantation in 2007, we have accredited 112 surgeons all over Europe, and we have given the honorary diploma in 142 surgeons in Europe, 75% of them department heads. And if you consider the fact that transplantation is a very small potato in surgery, we make a lot of noise usually in the newspapers, on television, but when it comes to numbers, it's a very, very small portion. These are really big numbers. When it comes to the examination of the sections, for example, of ophthalmology or anesthesiology, the applicants are up in the hundreds. Also, we are organizing preparatory courses for the examination. And the purpose of those exams, those courses, are not to teach people everything they want to know about transplantation and they were afraid to ask and all this in 2 days, is to help them to channel their knowledge to the format of the examination. And the reason to this is that all of them come from many different European countries, and obviously they are used to completely different systems of preparation and examination. And the format of those courses include state-of-the-art presentations, interactive sessions, exam simulations, and also the instructors come not only from the UEMS, but also from the local university. It was the first time we established something like this in the section of surgery, and it's becoming, I can tell you, very popular now within the UEMS. The previous preparatory courses were in Budapest, Santander, Limassol, and the next one is coming up next week in Tel Aviv, always in close collaboration, very successful collaboration, I have to say, with the local universities. Also, we offer the opportunity for accreditation of centers for training in transplantation surgery, not for a license to practice or not transplantation, but for training in transplantation surgery. And this training is both clinical and academic. And the process is very robust. There is an initial application coming from the institution about the history, the achievements, the trainees, the number of cases, the educational opportunities. And after a first review, there is an on-site visit by a committee of 3 people, 2 from the section and 1 from the European Society of Organ Transplantation. There is a second review by the section and then a recommendation for accreditation or not to the UEMS. And every center is being judged and marked for 18 different domains of activity: clinical, research, education, and management. And the currency is what kind of activity is per trainee. We don't care if you do 2,000 livers in your unit. The question is how much of this is going to the trainees, and if they are actively participating, and what is the career outcome for them after they are being trained in your center. And you can see here 4 centers we accredited last year, and I can tell you, for those of you who are not involved in the field of transplantation, that these are very, very high-powered centers in Europe. Also, and Jacques presented the overall project of ECMA, we contributed to the accreditation and the award of CMEs and CPDs to various educational activities in the field of transplantation in Europe in collaboration with the European Society of Organ Transplantation. And finally, we have under our umbrella developing examination boards for transplantation medicine, transplant coordination, and immunology. And this is the overall philosophy that every division is trying to have under its umbrella all the activity that is going on in the relevant field, and not only, strictly speaking, the surgical activity. The future plans is, number one, to involve the fellows more and more. We believe strongly that awarding the diploma is not the end, it's just the beginning of our collaboration. We want to deepen the collaboration of the Division of Transplantation with the national associations, in the case of the UK, the British Transplantation Society, and also there is expansion beyond Europe. The examinations and all the other quality control mechanisms I presented to you are open for application not only to candidates and applicants coming from European countries, but beyond that, with the proviso and the clear-cut explanation that this is not a license to practice medicine or surgery or anything else in the European Union. It's just a diploma of high-quality control. Also, we are examining the issue of revalidation, because you got your diploma, you are accredited at a pan-European level. The question is, what is happening 4 or 5 years down the road? And there are, 3 proposals on the table. Number one, do nothing. The hardliners believe that somebody should repeat everything from scratch to be reaccredited and revalidated. And other people believe that some way in between is a professional appraisal that can take place every 5 years. This is something up for debate, and we will know the outcome within the next few months. So you saw the activity of the Division of Transplantation. Try to multiply these times 11 for the other divisions of the section and times 39 for all the sections of the UEMS. It's an absolutely enormous enterprise and a very successful one. But I'm pretty sure during lunch, many of you will ask me, okay, this is fantastic, good work, well done. But do we need these European quality control processes? We have to face some facts. The first fact is that there is free movement of healthcare professionals within European countries. And of course, by European law, all qualifications are mutually recognized. But believe me, we all know nowadays that this is not enough. People need to know if you are qualified not in your own country only, but if what you have achieved in your career is enough for you to practice in any European country. Even more, we have free movement of patients in many different European countries. And they are the ones who are demanding to know the status, the standards of qualification of the various healthcare professionals. And also, we have pan-European healthcare projects. Again, to mention the field of transplantation, we have a situation where all transplant centers have to be licensed by the EU. And they need to prove that their employees are up to speed. And the only way to do it at the moment is through the European examinations and quality control mechanisms. Also, we have a new world in front of us and we face new realities. We have post-CCT training to evaluate and accredit, which is being done very sporadically and not robustly at all across Europe. We have the issue of training of specialists who already have their accreditation and want during their specialization to be retrained in a specific area. And of course, the very hot potato of revalidation and reaccreditation. And finally, we have to rethink about the whole provision of healthcare services, mentioning the financial challenges we are facing, everybody's aware of that, the invasion of technology, the changing of the landscape of the health problems that we are facing, and finally, the different demands as years goes by our patients who are focusing more and more on issues of quality control, for example. These great, enormous challenges for the future are not only UK or German or Austrian or Greek challenges. These are European challenges and beyond. And if we want to face them, as my father always used to tell me, you have 3 options. Either you lead, or you follow, or you just get out of the way. So where do we want to be in this international scene in the 21st century? I think the answer is very clear. We want to lead. But we have inspired as individual nations the whole world with our fantastic achievements and traditions. But when it comes to leadership, especially for these big challenges, I believe that we can only do it collectively as Europeans. Or if you wish, we need to ensure that we work together, we support each other and face the challenges. Or in other words, to honor this great city and one of my lifelong passions, to ensure that we will never walk alone. Thank you very much for your attention.